Webinar on a COVID update. I'll be introducing our speaker in just a moment. My name is Carrie McClellan. I'm the Outreach Manager for ElderHelp, and I also help to coordinate our family caregiver webinar. So thank you so much for joining this morning. I know today's topic is an important one for us all. There's so much information coming out, and it will be good to hear from Dr. Gunta, and she'll kind of help us understand that a little bit better. Before we get into that, I just wanted to share a little bit about ElderHelp and our mission. So we are a nonprofit organization that supports seniors in our community by helping them to maintain their independence in their own home. During the pandemic, we have been focusing on their essential needs and services. So we've been providing food and items through our pantry. We've transformed our office into a pantry, so that's where all of those items are coming out of. We are also continuing to provide rides to medically necessary appointments. That's something that we want to make sure that our clients are able to get the appropriate medical care that they need. And we are doing a lot of check-ins with them via the phone. We're not doing in-person visits, and so we're wanting to make sure that they do feel connected, that they are continuing to have that socialization, because it is so important to prevent isolation during this time. So that just gives a little bit about what we're currently offering. Our family caregiver support program is really important. We not only provide services to seniors directly, but also family members who might be caring for an aging loved one at any stage. So we do offer information and referral services. So if you have any additional needs or looking for benefits or what might be available to your aging loved ones, please feel free to reach out to us, and we're happy to help you through that process. These webinars that we offer on an almost monthly basis, this month we're doing 2. We really want to make sure that these topics are helpful and relevant to you as a family member, but also a community member. So I know that we have a variety of individuals who are joining us this morning, but I hope that you'll take away good information from today's topic. I did want to mention that we also have online courses that are available for family caregivers to help navigate that process. So whether you're just getting started or wanting to find out what kind of the next steps might hold, or what your future might hold as a family member who's caring for a loved one, those courses are really helpful, and they're all available for free. We also partner with local organizations like Alzheimer's San Diego and Southern Caregiver Resource Center to make sure that we are reaching more family caregivers in our community. So those are great resources as well if you're looking for additional support. All right, and I'm very excited about today's topic. I had the pleasure of hearing Dr. Gunta speak a couple of weeks ago, and I just felt that she provides a great overview of the COVID information that is coming out that is changing every single day. So I'm excited to be able to introduce her to you all today. So Dr. Gunta is the Director of Pediatrics of Vista Community Clinic, and is involved in other clinic-wide projects, including education on the COVID vaccine. Vista Community Clinic's mission, as well as Dr. Gunta's ideals, match, focusing on providing quality care to the underserved in our community. Dr. Gunta wants her patients to have a home for all their medical needs. She believes that providing optimal care at a community facility improves the health outcome of the individual and the society at large. So without further ado, Dr. Gunta, thank you so much for taking the time to be here today. And I am going to pass the reins over to you. Before I do that, just a reminder that if you do have any questions throughout this morning's webinar, please feel free to use the raising of your hand feature. You can type in your questions, and then we will go through those at the end of the presentation.
Thank you, Carrie, for that introduction. Good morning, everyone. As Carrie mentioned, I am Dr. Gunta with Vista Community Clinic, and I'm hoping to, with these presentations, help answer any questions you might have and just give an update of what is going on with the cases in the community, as well as what's going on with the COVID vaccines. Carrie, it doesn't seem like I'm able to advance the slides.
Okay, give me a second. It looked like it was going to on my end, but okay, try that now.
Oh, doesn't seem
No.
like. Maybe you can just do it for me.
Okay.
Okay. So this first slide, I just pulled the numbers a couple days ago. It is the state of COVID cases in our county, in San Diego County. As you can see, the total number of cases we've had is about 260,000, and the total number of deaths is about 3,000 in San Diego. Thankfully, the number of positive cases have been decreasing, but as you can see, the number of deaths have had a significant lag as compared to the decline in the positive cases. So that is something I want everybody to keep in mind. The other important thing to note is absolutely, we're all happy and we can celebrate the fact that the number of cases are decreasing, but this is not the time to lower our guard and dramatically decrease the restrictions that we've had in the community. The reason being, if you notice, the number of cases back in early and mid-October, we are still higher than that number of cases. Also, in the last couple of weeks, we have not noticed any further decline in the cases like we have seen in the month of February. So that again tells us that there is still spread happening in the community, and that again is reflective of the deaths that is happening in the community, which is what we ultimately want to prevent. Can I have the next slide, please? Oh, looks like I was able to do it now. And then this is the number of cases in California. Over 3 million cases, total cases, and over 51,000 deaths in California. The decline in cases is pretty similar to what is happening in the county, and the pattern of deaths is also pretty similar to what is happening in San Diego County. It's actually pretty reflective of what is happening throughout the nation as well. Again, what I would like to point out is the number of deaths lag behind. We are still losing a number of people on each day due to COVID, and also that the number of cases, even in the state right now, are about where we were in October. So unfortunately, we haven't yet reached the point that we can say that we are getting the pandemic under control. I put up the slide from our County of San Diego website, just showing the racial breakdown of how the COVID has affected our different communities. If you look particularly in this column of rate per 100,000, you can see that our Hispanic community and as well as our Native American community seems to have been affected the most. They have numbers as high as 11,000 and 15,000 cases. This is the rate per 100,000 people. It's much higher than the average or compared to the white community, which is about 3,000 to 4,000 cases per 100,000 people. So, serving the underserved, working in an FQHC, this is something that is striking to me, that how it has differently affected different communities and how there is so much more work yet to be done. Things are certainly improving. Like I said, there's definitely light at the end of the tunnel, but again, this is not the time to completely loosen all the restrictions, as we definitely have to get the cases further down before we have that relief in sight. This is a graph that was published in the New York Times, and it clearly shows how our surges have happened after holidays, and suggestive that the gatherings and the social gatherings that take place during these holidays have contributed to the surges that we have seen. You can see Memorial Day, Labor Day, and then this is what we call the surge over the surge, with the 3 holidays happening in line, the Thanksgiving, Christmas, and New Year. Recently, again, we've seen the decline, but like I keep warning that it's not, we are still not back to even our October levels as yet. Now, just shifting gears a little bit, I would like to talk about the vaccine. The first question that seems to come up from many is, how was this vaccine made so quickly? The vaccine was made what can be considered quite quickly is because coronavirus as a group is a common virus that's been studied for decades in the scientific community. In fact, it did cause a couple epidemics in the past, which one was the SARS epidemic, which was a subacute respiratory syndrome in 2002, and then the Middle East respiratory syndrome in 2012. So this has been studied in the past by the scientific community, not specifically this novel coronavirus, but as a group of viruses, this has been studied, and there's a lot of data out there. And of course, there's been a lot of money put into this whole process, both by the United States government and a lot of private companies working on the vaccine as well. And even there was stockpiling of product even before knowing that the vaccine is efficacious or not, just so that everything was ready to be sent out if it was proven that the vaccine is efficacious. And also the public interest. Everybody has been keen on ending this pandemic. There has been good participation in the vaccine trials by people and by institutions, and all that has, really helped in getting this vaccines out the door. A little bit about the how these clinical trials take place for the vaccines prior to them getting approved. Phase 1 is usually a small group of people where they mainly test for the safety of a potential vaccine that they're testing. Phase 2 is a larger group, and this is used to study both the effectiveness as well as continued study on the safety of the vaccine. Then comes phase 3, which is a significantly larger group where, the standard dose of what is determined to be the standard dose is given to a much larger group, and continued study on safety and effectiveness. It's only after this phase 3 is when the information is submitted to FDA for potential approval. Right now, 3 vaccines have been approved by FDA in the United States: Pfizer, Moderna, and the Johnson & Johnson vaccine. And they've all been approved under what is called emergency use authorization. This emergency use authorization is still absolutely an approval process by FDA. I have heard some concerns that the vaccine has not been approved by FDA and it's being given, and that is absolutely not the case. All 3 vaccines have gone through the approval process of FDA. They've reviewed the data that is out there. They've looked at the clinical trials that have been done for each of these vaccines, and only then it's been approved. This is just a process to make these medical interventions and vaccines available to the public during emergencies, during pandemics such as what is going on right now in our country and in the world. So all 3 of them have gone through these phases. Like I mentioned in my earlier slide, Moderna had 30,000 participants in the phase 3. Pfizer over 40,000, and Johnson & Johnson also 40,000. And all three have been approved by FDA for emergency use authorization. Numbers have been published about the efficacy of these vaccines, and the numbers published are both Pfizer and Moderna closer to 95%, and Johnson & Johnson about 72% in the United States. I definitely want to mention that number with the caveat that these numbers are not apples to apples comparison. Moderna and Pfizer phase 3 trials happened much earlier in the pandemic when we did not have the variants of the COVID virus that we are seeing now in the community. So their efficacy is, the published numbers are much higher than what is published for Johnson & Johnson. Johnson & Johnson phase 3 trials happened when these variants were already in the community. So this does not mean that the Johnson & Johnson vaccine is less efficacious than the previous vaccines on the market, Moderna and Pfizer. It only means that Johnson & Johnson is still significantly efficacious against the virus, including the variants. So this just looking at the numbers should not undermine the confidence in this third vaccine that is being deployed right now. In fact, the way I see it is it's actually really encouraging numbers that even with the variants present in the community, it had such good efficacy. And again, on top of that, Johnson & Johnson is just one dose, while Pfizer and Moderna are 2 doses. So it has such good it was inducing such good immunity that only 1 dose was sufficient for the Johnson & Johnson. So all 3 vaccines are excellent. All 3 vaccines are significantly efficacious against that severe COVID disease that we are trying to prevent, the hospitalization we are trying to prevent, the deaths we are trying to prevent. Moderna and Johnson & Johnson are approved for over 18 years, while Pfizer is approved for over 16 years. Regarding the anaphylactic reactions to these vaccines, it is only for those with allergies to other vaccines or other injectable medications. If you've had food allergies, environmental allergies, then there is absolutely no concern. You can still go ahead and get one of these vaccines. But if you've had a significant reaction to an injectable vaccine or an injectable medication, that is when we are advising to discuss with your allergist and the vaccine be given in a hospital setting where any emergency can be dealt with. But we all know that it's the food allergies and environmental allergies that are more common among the population, and that is absolutely not a barrier to get these vaccines. Other vaccines that are, being used in other parts of the world. One is Oxford AstraZeneca, which is being used the most. It's been approved in United Kingdom, in Europe, and in India. And then there's Novavax vaccine. There's a lot of work going on in the scientific community with all these vaccines. There's a nasal vaccine undergoing these trials, and there's an oral vaccine against COVID. And if those 2 come out, then the administration is so much more easier. So just wanted to mention that there's a lot of work going on in the scientific community with these vaccines. How do these vaccines work? So Pfizer and Moderna, they are messenger RNA vaccines in which so a small amount of the viral material, which is just the messenger RNA portion. It's not the entire live virus. It's just a portion of the virus which is injected, and that helps induce the immune response through the viral proteins. The Johnson & Johnson vaccine, which was recently approved, as well as the Oxford vaccine, which is approved in Europe and India. These are modified adenovirus vaccines. So the adenovirus, which is a different kind of virus, is modified such that it cannot replicate once injected inside our body, but it helps transfer those proteins that we need to induce that immune response. And the live virus is not being given in any of these vaccines, the vaccine cannot absolutely give you the COVID disease. And as I stressed earlier, the effectiveness of the vaccines, those numbers need to be interpreted with, a lot of other information along with it as to when were the phase 3 trials done, what was the situation in the community at that time, and things like that. Again, these vaccines were designed to prevent severe infections, to prevent hospitalizations, and to prevent death. And the primary trials have proved that all 3 vaccines are nearly 100% effective against that criteria. They were really not designed to prevent mild COVID infections or the spread. They're still pretty efficacious in doing that, but they're just not 100% effective in preventing mild infection or spread. And that's why even after you've had the vaccine, we want you to continue to wear a mask and social distance until a good section of the population can get immunized. Once we've reached the herd immunity, we can certainly decrease the restrictions that we are having right now. But until then, we have to continue with the masking and the social distancing and the washing hands, with the vaccine being another tool to help us end this pandemic, but it cannot be done all by itself. The COVID vaccine is a reactogenic vaccine. What does that mean? It just means that once you get the vaccine, especially after dose 2 of the vaccine, or let's say you've had COVID, the disease in the past, you tested positive for COVID, and now you're getting the vaccine, then you may have some symptoms after you get the vaccine. These symptoms can be just pain at the site of the vaccine. It can be a mild fever, headache, maybe chills, but these symptoms will last only 24 to 48 hours. If you ask me, that's a good trade-off for not getting the severe COVID disease, not ending up in the hospital, and not dying from COVID. They're just the reactions after the vaccine, it's limited, it's time limited, it's just 24 to 48 hours. From my personal experience, after dose 2, I did have, very mild chills and a mild fever, a headache, but it didn't even last 24 hours for me, and I was completely fine after that. Like with any other vaccine, unfortunately, there are some myths floating around regarding the COVID vaccines as well, and I would like to clarify some of that. One, some are thinking that if they've had the COVID-19 and recovered, they don't need to get the vaccine when it's available. And I would absolutely discourage that behavior. We know that even if you've had the COVID disease, and you've recovered from it, the immunity is lasting only about 2 to 3 months. It's fading after 3 months. But as compared to if you get the COVID vaccine, we know that it is lasting significantly longer than that, even up to a year. We don't know if it will last more than a year because we just don't have the data on that yet. But hence, do not be under the impression that if you've recovered from COVID, you do not need the COVID vaccine. You still do need it to protect you for longer periods of time and for higher levels of immunity. Then concern about some severe side effects of the COVID-19 vaccines. Like I mentioned, if you have a history of significant reactions for other injectable vaccines or injectable medication, talk to your allergist. The other reactions that we are seeing after the vaccine is expected. That is something we know is going to happen because it's a reactogenic vaccine. And it is time limited. It's only 24 to 48 hours, and it's a good trade-off. The COVID-19 vaccine does not alter DNA. We use all these words like it's a messenger RNA vaccine, it's an adenovirus vaccine, and uses DNA, but that has nothing to do with your own DNA that's inside your body. It does not alter your DNA. Another myth floating around is that it causes infertility or miscarriage, and that is absolutely not true. We have so much data that that is not the case. And this myth was spread by a former Pfizer employee who is no longer with Pfizer, and I don't know, he's out there spreading this myth, which is absolutely not true. All three vaccines have nothing to do with the eggs, and even if you're allergic to eggs, that's not an issue at all. You can absolutely go ahead and get the COVID-19 vaccine. And none of these vaccines have the preservatives that people are concerned about, like mercury or thimerosal and all those. They just don't have it. Regarding pregnancy and the COVID vaccine, now none of these phase 3 trials that I mentioned included pregnant or breastfeeding women. But just based on the scientific information we have from some of these other vaccines, which are similar, messenger RNA or adenovirus vaccines, we predict that they're safe for pregnant and breastfeeding women. We just can't assure you because phase 3 trials were not done, but since the vaccine has been deployed in the community, we know of a lot of pregnant and breastfeeding women who have already gotten the vaccine and have been completely fine and have had safe continued pregnancies and childbirth since then. Also, the expert community, ACOG, which is the Association for Obstetrics and Gynecologists, they have also, expressed confidence in the vaccine. We just want you to discuss with your PCP and OB if you're pregnant or breastfeeding about, getting this vaccine. As I mentioned, right now, there are these variants. The COVID virus, unfortunately, has mutated into a few variants in different parts of the world. And 3 primary variants that are of concern. And it seems like all 3 variants are more transmissible, which means they more easily spread from person to person. The UK variant is right now being detected in many, many states of our country and in over 80 countries across the world. It is definitely more transmissible, that it more easily spreads from person to person, but at least as of now, we are seeing that all the vaccines out there are quite effective against this variant as well. The South African variant now has been seen in about 14 states in our country and in about greater than 46 countries. There is some concern about the degree of vaccine effectiveness against this variant and the other variant, which is the Brazilian variant. But what I would like to say is, yes, the overall vaccine effectiveness against these variants is less than the originally published numbers of 95% or so. It is probably somewhere closer to 60 or 70%. But I see that as 60 or 70% higher than no effectiveness if you don't get the vaccine. So it is still significantly effective. It is still significantly effective against preventing that severe COVID disease, against preventing hospitalization and death. So in spite of these variants and in spite of slightly decreased effectiveness against these variants, the vaccine is still a very important tool that we have to fight this pandemic right now. There's also a California variant that we are noticing in California, but there is some question of bias sampling. We quite don't know yet what that means, and so we don't have the complete information as yet. So after being vaccinated, like I said, it takes time to build this herd immunity. So that's why masks and the personal protective equipment and the social distancing, they're still required after vaccination. And also because variants have complicated the picture. And, we continue to test the efficacy of these vaccines against the variants. And we know they're effective, maybe not to the original levels, but they are effective. And also, these variants that are being formed, they're only being formed because the virus has this chance to keep replicating as it spreads from person to person. if we can stop the spread of this virus by our continued precautions that we are taking, the less the virus is able to spread, the less it's going to have a chance to create these variants. And hence, all those precautions are still required at this time that we are in. One thing, because we are so confident that post the vaccine, you are well protected. If you're 2 weeks out from your dose 2 or dose 1 of the Johnson & Johnson and you're within a 3 months since you've received the vaccine, even if you've been exposed to a positive case, you can still continue to come to work as long as you're asymptomatic. So that means less missed work days. That means more people still continuing to be in the workforce. What does getting back to normal look like? It still is going to take all our tools. Getting vaccinated, still wearing a mask, continuing the social distancing and the washing hands until we can achieve that herd immunity of a significant sizable population immunized. Tiers of vaccine priority have been released, and I'll show who we are vaccinating right now in San Diego County. So all in healthcare, all those age 65 and older, and all those who are at risk for exposure at work with respect to the essential services. It's soon going to open up for 16 to 64 years with certain health conditions. So if you have a chronic health disease, then you can discuss with your doctor if you would be eligible for this vaccine in the next phase. San Diego County has, opened up their websites where you can choose by location or by day. Yes, there are certain days that you might not find an appointment. The vaccine availability is improving, but it's still not where we would like to see it. So things are definitely improving. And California State also has its website of myturn.ca.gov, where you can go look up who is offering vaccine around you. You should also, I also encourage you to just call your doctor's office and find out if they're offering the vaccine, because that might be the easiest way for you to go get the vaccine if you're eligible based on the criteria. San Diego has opened another center, which is called the Monoclonal Antibody Regional Center in Escondido. This is designed to prevent the progression of COVID disease for those who have tested positive. So if you've tested positive and you're thankfully not sick enough to be hospitalized yet, but we want to make sure that you don't get to the point that you end up being hospitalized and getting really sick, we want to already give you something called monoclonal antibodies. These have been shown to decrease the risk progression of the disease and fight off the virus. And this has also been approved by FDA. If you're over 65, you can self-refer yourself. You can just walk into the center and get these monoclonal antibodies. If you're under that age group but have a disease that still puts you at risk for progression of the disease, then you just need a referral from your doctor to get admitted to the center. It's not even an overnight admission. It's something that happens in the daytime, and it is designed to prevent the progression of COVID-19. Again, these numbers are from a couple days ago. Vaccines administered in our state are close to 9 million. That's a great achievement. And we continue to improve on that. And the other thing that I would like to point out is somewhere in February, we finally reached that mark that the number of vaccines we administered in our country is higher than the number of cases we've had. So that was another good achievement. And we've administered about 75 million doses in the United States as yet. But, the total number of people who received the vaccine would be lower than that, because the first 2 vaccines that came out do require 2 doses. That's all I have right now. If anyone has any questions, I'm open for that.
Thank you so much, Dr. Gunta. I love how you explain everything. I know we all get so much information every single day, sometimes multiple times a day, and it's just helpful to hear somebody who understands it all and can kind of break it down for us a little bit. So thank you for your time, and thank you for sharing all of that information with us. It's nice to know that we see the light at the end of the tunnel, but we have a lot of work still to get there, and it's going to take all of us to continue doing that. So thank you for doing your part too. If anybody has any questions, let's see, now is the time. Feel free to type them in, and we'd be happy to answer those. I know it's a lot of information and we probably have a million questions, but we're happy to take some if you do have those. Looks like there was one going in, but I don't see it now. So let's see. All right, while people are typing, I'm going to just give a save the date. And first of all, thank you again. We greatly appreciate your time, Dr. Gunta, with us today and sharing your expertise with us. And we'll be sure to share this with our community as well, so that we can make sure more and more people have a better understanding. We do have another upcoming family caregiver webinar actually taking place next week. So if you're interested, it would be on the topic of Dementia 101, and it will be with Amy Abrams as the speaker. She's with Alzheimer's San Diego, the director of education there. So if you're interested in hearing more about that topic, please sign up for that as well. And I'll leave it up on this slide if you're wanting to stay connected with ElderHelp and know more about the upcoming webinars that we have, or would like to receive our newsletter. You can do all of those things through our website, or you can feel free to reach out to me and I can connect you. But I will say right now, we're going to keep it open for a few minutes for any questions. So if you do have them, now's your chance. So please ask. We want to make sure that you have those answers, and we appreciate everybody's time for listening in today and taking an interest in seeing how we can continue to support our community and ourselves and our family members. So it looks like we do have a question coming in. And this person is asking, if I've had COVID a few weeks ago, shall I get the vaccine, 1 or 2? So maybe can you clarify, you tested positive for COVID, and you're wondering if you should get the vaccine now or if you should wait? Is that what you're asking?
I think they might be asking if it is 1 or 2 doses. So the 1 or 2
perfect.
doses does not change irrespective if you've had COVID or not. It only depends on what the brand of vaccine you're getting. Pfizer and Moderna would still be 2 doses. Pfizer is 21 days apart. Moderna is 28 days apart, and minimum of 28 days apart. If it's a little over that, that's completely fine. And Johnson & Johnson would be a single dose. That does not change irrespective if you've had COVID in the past or did not have COVID in the past. We've only noticed that those symptoms I was talking about, the mild fever or those chills, which most of the people are noticing after dose 2, if you've had COVID in the past, you may notice it after dose 1 as well, but you still need that dose 2 for the full immunity boost if it's Pfizer or Moderna. The only thing we ask is you be at least 14 days since your positive test of COVID, and that you be symptom-free from all the major symptoms like the fever or the really bad symptoms of COVID. If you've had, some people have these lingering symptoms of the taste change and sometimes headaches lasting weeks after they've tested positive for COVID. And if you still have those symptoms, it's completely okay to go ahead and get the vaccine. We just say that you have to be at least 14 days since your positive diagnosis and not have the major symptoms like fever or any breathing trouble.
Great, thank you. I think that kind of answers that question, but Debbie, if you do have any follow-up questions, please let us know on that. And if anybody else has any questions, please submit them. Okay, so that helped answer her question. Thank you. Anybody else? I don't see any other questions coming in. So what would you recommend, Dr. Gunta, if somebody does have a follow-up question, would it be best that they contact their primary care physician to ask those questions? Or is there any information that Vista Community Clinic is offering at this time for the
I think some basic information is on our website, but yes, if you have any question, reach out to your primary care doctor, and I'm also happy to, answer questions. You can send them through Carrie, and I'll be happy to, answer them to the best of my knowledge. And the information is ever changing, and the criteria of who is eligible keeps changing as well. So the san diego.gov website is a good website to get us who is eligible, where you can get your vaccine, that kind of information. If you have other vaccine related information, CDC is a great website to gather that information on generally on the vaccine itself. But if you think it's too overwhelming, just call your doctor, or I'm happy to answer those questions as well.
Wonderful, thank you. And I know I've shared with our family caregivers as well in the past, the information about being an informal family caregiver does allow them to have access to receiving the vaccine if they receive a letter from the person they're caring for from their physician. So I'll be sure to send that information along with the recording of this as well. So you'll have a lot of good information that you can take a look at. It looks like just one follow-up question in regards to having had COVID, and will the symptoms of the vaccine cause problems since she has had COVID and tested positive for that recently?
Yeah, so as I said, if you've had COVID in the past, you may have symptoms after dose 1 and dose 2, but they're still going to last only 24 to 48 hours. The duration of symptoms, we have not seen any change irrespective of if you've had COVID or not had COVID. In fact, I've heard from some colleagues who did end up getting COVID and now have gotten their vaccine, that some of their symptoms that were lasting even well beyond 14 days of having had COVID, they were still having tiredness or headaches, and they say that since they've had the vaccine, it's actually helped them recover faster from the disease itself. So that's really encouraging news that we are hearing as well. So and that's why I highly encourage, it doesn't matter if you've had COVID in the past, you still should get your vaccine when you're eligible for it.
Wonderful, thank you. Okay, and she says no more symptoms, so that's good. Okay. It looks like that's all the questions that we have right now, so we will go ahead and close out for today. But again, thank you so much, Dr. Gunta, for your time and sharing your expertise with all of us, and we appreciate that. And I know it's a busy time for you as well, so I appreciate you setting us a bit of time to do that today.
Absolutely. Thank you for inviting me.
Of course. All right. Take care.